Hi, this is Jackie from Strength Therapy. I'm going to show you guys a variation on squats that will actually help your hip, your sacrum feel a bit better. For some people, you can give this a try. And the first step I'm going to show you is without any of the props, but just kind of the setup of it. So what you want to do is you want to first find like where your glutes can be the most accurately activated. Okay, and how you do that is you basically don't even worry about thinking about your feet and where they're supposed to go. You basically just squeeze your glutes and just kind of take a couple steps in place. Don't even look down, just squeeze your glutes as much as you can and then stop. And that's basically where your feet should be. If you look down, you might have one foot a little bit more skewed than the other, one forward more than the other. It doesn't really matter. Okay, so what we're going to do first is we're going to do a squat, but we're going to do, I call it a shitty squat. Basically, we're going to press our knees towards each other as we go down, and then we're going to press our knees outwards as we come back up. So it looks kind of like this. So it's going to come down like this, so it's going to adduct together, and then as we come up, we're going to press our knees apart. Okay, when we press our knees apart, we're going to be using our glutes to squeeze open so the knees just naturally come apart. Okay, so again, coming down, knees cave in, coming back up, knees press out with the glute activation. And you should be feeling those glutes fire pretty well because we already have that set up. Okay, you can do a few of those just to get started. So here and out, here and out. When you're doing these, you want to make sure that your feet are planted on the floor, that no toes come up. Okay. The next step is to add a little bit of load to it. So once that feels pretty good, you want to add a little bit of load to it. And you can get an elastic band, or I have this, this is kind of like a slingshot. And you want it to be something that's more narrow than your hip, so tighter than your hip, or for where your legs are supposed to be. So you're going to just wrap it around above the knee, so not on the knee, not below the knee, but above the knee. And then see how, like, if there's no tension here, this is too narrow for me, that's perfect, because we want a little bit of tension going outwards. So now again, we want to go back into that good spot again. So I'm just going to squeeze my glutes and let that just kind of dictate where my feet go. And that's basically how it is for me right there. Okay. Next step is we're going to take a yoga block. You can take a book. I like a yoga block because it's a good distance for me. And you're going to put that basically between, right in the elastic band between your thighs. Okay. So now what we're going to do is, as we go down, we squeeze into the yoga block, and as we come up, we're going to push against that the hip band. Okay. So now we have isometric contractions that go along with this resistance. Okay. So it's going to look like this, and it doesn't really look like that much different, right? Because it's pretty isometric. There's not a lot of range of motion, but I'm getting a lot of the activation with my adductors here, and then here I'm using more of my glutes. Okay, and again, of course, you want to keep a nice straight body posture. You don't want to lean forward or anything. Feet are staying planted on the ground. So now I'm squeezing in here, and now I'm pushing out with my glutes. Squeezing in and pushing out. Squeezing in and pushing out. Okay, you can do a few of these, and then see how your hip feels, see how your back feels, maybe even your knees and your feet. This seems to do a lot of wonders for people depending on what they have going on, but you can just give that a try.